In this lecture, I will cover the remaining cranial nerves from 7 to 12. 7th cranial nerve is the facial nerve, which has motor innervations and as well as the sensory innervations. So motor innervations control your facial movement and the facial expression, while the sensory innervation control the taste sensation from the interior two-thirds of the tongue. It also controls the tear production from the lacrimal glands. So how you inspect is to check the facial nerve at the rest, or you check the any asymmetry, and you ask the patient to raise the eyebrows, close the eyes tightly, show the teeth, or wrinkle his forehead. If a patient is able to perform this, it means the facial nerve is intact. Next is the vestibular cochlea, balance and the hearing. So vestibular part functions in a balance, orientation, and equilibrium, and a cochlear part functions in the hearing. So it is involved in the balance and the hearing. There are two tests to examine the vestibular cochlear nerve is this Halpic test and a Wren and a Wilber test. So in this Halpic test, examiner rapidly move the patient from the sitting to the supine position, and the head is turned to 45 degrees towards the right, and then after the 20 seconds the patient is turned back to the sitting position. If no nystagmus is observed, the procedure is repeated on the left side as well. Next part is the Wren and the Weber test. It is used for the hearing loss. So what happened in the Wren test? The examiner strikes the tuning fork and places it on its mastoid process to check the bone conduction. In this way, movement of a tympanic membrane is heard. Next is a Weber test. So Weber test is a screening test for the hearing. So tuning fork is placed in the middle of the forehead and the patient report about the sound heard in both ears. So Weber test is positive or Weber test is normal when the patient heard sound equally in both the ears. Ninth cranial nerve is the glossopharyngeal nerve, posterior one-third taste and a gag reflex. So glossopharyngeal nerve is responsible for the swallowing gag reflex, and it also gives branches to the posterior one-third of the tongue. So muscles in the oral cavity and the upper throat are supplied by the glossopharyngeal nerve. To examine the glossopharyngeal nerve, check general taste sensation on the posterior third of the tongue, and also check the gag reflex. This is also known as the pharyngeal reflex. What you do is you touch something on the roof of the mouth. After this, a reflex action is happens to prevent the choking. If there is a weak gag reflex, it can be a risk factor for the aspiration pneumonia. 10th cranial nerve is the vagus nerve. So it supplies the muscles of the phalanx, soft plate, and the larynx. And it also carries sensation to the epiglottis and the root of the tongue. It involves in some reflex actions like coughing, sneezing, swallowing, and the vomiting. To examine the vagus nerve, what examiners do is to check the gag reflex. So anything soft like a soft cotton is tickled at the back of the throat. This causes the gag reflex. 11th cranial nerve is the spinal accessory nerve. Shrug shoulder against the resistance or turn head against the resistance. So this nerve innervates your sternocleidomastoid and as well as the trapezius muscle. So it provides the motor control to both of these nerves. Trapezius controls shrugging of a shoulder and sternocleidomastoid controls the action of turning the head. To examine the spinal accessory nerve, you ask the patient to rotate the head, shrug the shoulder against the resistance. If he can do, then the spinal accessory nerve is intact. 12th cranial nerve is the hypoglossal nerve. Check resting position of a tongue, stick tongue out and side to side, and speech articulation. So hypoglossal nerve is a motor nerve innervation to the tongue musculature. So you ask the patient to protrude the tongue, or you ask the patient to push the tongue against the cheeks, and also check the resting position of a tongue. If the nerve is damaged, that may show fasciculation. Like fasciculation, there may be involuntary contractions and the relaxations in the tongue. If a patient can perform this, then the hyperglossal nerve is intact.